The evaluation for people with mood disorders in my office is very similar to the evaluation for people who come in with any complaint. The way I tend to look at people is in their experience. How are they manifesting their health experience? For some people with mood disorders, they tend to manifest their experiences emotionally, but other people manifest those much more physically. So the evaluation process is pretty similar. I'm going to look for how their body is responding, how their mind is responding, and then where their strengths are. Really the main question that I'm asking is, where is your body doing well? Where is your mind doing well? And how can we expand that process so that what we're doing is looking for an expansion of health, not a diminishment of what's wrong. There's been some interesting research that's come out in the past couple years on chronic pain and depression. What they found is that both tend to have a decreased serotonin levels. And so oftentimes people with chronic back pain are given antidepressants with really good results. The biochemical experience is very similar for a lot of people. And what tends to be different is how they express that experience. Some people tend to express their experience emotionally. Right? When there's pain in their body, they feel depressed, they feel manic, they feel different emotions. Other people tend to not express their experiences emotionally. They tend to talk more about pain or restricted motion or disease process. In a lot of ways, what we're finding is the underlying experience is the same and that different people manifest those experiences very differently. One of the things that I then do is help people on that more basic level of looking at the underlying cause that it, for them, is expressing as bipolar, for them is expressing as depression or anxiety, but for someone else would express as pain, and oftentimes those two overlap. When I work with physicians and when I work with talk therapists, what I'm doing is providing another avenue. A physician will often look at the biochemical impacts of disease. They'll look at those disease processes from a perspective of what pharmaceuticals can we give this person to ease the condition. A talk therapist will look at how can we create a narrative around that? How can we create a logic? And what I do is then provide another alternative to how can we look at what's going on in the body on an emotional level, on a spiritual level, on an energetic level. And so it's another avenue to that experience. Chiropractic can be incredibly valuable for people with depression and with mood disorders because it provides another alternative. Right? That a lot of times people who come to me have not been able to get the results that they wanted through traditional means. Oftentimes in something like talk therapy, a lot of emotions are brought up. A lot of experiences come to the surface and the body needs a way to process that. People tend to leave talk therapy sessions with a lot to work through. They can work through that intellectually, but I provide an alternative to work through that more physically. Great. When people come in with depression, there are two things that happen. First is they get a chance to experience their body in a nice way. They get to lay down, they get to relax, they get to have some sort of self-care that's really valuable. Someone touches them and someone's paying attention to them and someone's caring about them, and that's all nice. And it's not so clinical, it's not so medical, it's not someone poking at them, it's somebody paying attention to them. And that can be really powerful. The other thing that happens is that we find where their body has strength. We find where the body has energy. In people who are depressed, they tend to be pretty disconnected from what's going well, where their energy centers are. Oftentimes people will say to me, I don't think there is a place of strength in my body. I don't think there is a place of energy. And there is. It's just hidden and it's just smaller. And when I put my hands on someone, I can help them find that very quickly and just point it out, have them take a breath into it, have them notice that it feels good right there. And that's often a very new experience. And once we can expand that energy, they have more energy. They have more vitality. They have more of an enjoyment of life because they've found the parts that are doing well in their body.